This slideshow is a presentation by Amy Doyle and Brooke Hill covering generalized anxiety disorder, its diagnosis, some treatment options, and special considerations for adolescents. Anxiety is a normal human emotion and is not to be considered in and of itself a disorder. In fact, in many situations, it can be considered a positive adaptive trait, such as for soldiers in combat needing to stay alert. In order to qualify as a disorder by the DSM-5, the anxiety must cause clinically significant distress or impairment, which cannot be the result of either another medical mental disorder or substance-induced. Many of the anxieties listed in the DSM-5 are focused on specific fears, but generalized anxiety disorder is not focused on anything specific, though it often presents as exorbitant fears over everyday activities, yet the specific trigger typically shifts throughout the day. This disorder is marked not so much by the worrying events themselves, but by the distress the client has concerning her inability to control the anxieties associated with the triggers. Its prevalence is approximately twice as high among women as among men. By definition, GAD is chronic. It must be present for at least 6 months to be diagnosed. It often presents in primary care situations as somatic symptoms, such as headaches, stomach issues, or recurrent abdominal pain. Major depression is often a coexisting condition, making it potentially difficult to separate the symptoms of each because they may overlap. Approximately 35% of those with GAD self-medicate with alcohol and drugs in hopes of relieving the symptoms of the anxiety. During the assessment phase of someone you suspect may have an anxiety disorder, particular attention will be focused on the person's fears and worries. Note that many clients with anxiety disorders may be very reticent to divulge detailed, inaccurate information due to their perception that the thoughts are clearly excessive or maybe even crazy. It is also significant that whatever the client's assessment of their own worries, he or she does experience distress associated with an inability to control the concerns. Randomized controlled trials have evaluated a number of psychotherapeutic techniques for generalized anxiety disorder, including cognitive behavioral therapy, and the evidence is strongest for the use of CBT, making it considered a first-line treatment. Behavior therapy generally falls into 3 historical categories: traditional behavior therapy, cognitive behavior therapy, and contemporary contextualistic approaches such as acceptance and commitment therapy and mindfulness therapy. Standard CBT for generalized anxiety disorder involves cognitive restructuring to help patients understand that their worry is counterproductive, exposure therapy to enable patients to learn that their worry and avoidance behaviors are malleable, and relaxation training. The main focus is on learning skills to manage anxiety. ACT emphasizes acceptance, cognitive diffusion, being present, focus on the transcendent self as context, values, and committed action based upon those values. Acceptance takes hold as the client accepts the painful experience and releases the need to control or avoid unpleasant feelings associated with the experience. Studies done comparing ACT with other therapies, both cognitive-based and otherwise, have generally identified ACT's effect to be clinically significant.
Preferred pharmacological treatment involves the use of a selective serotonin reuptake inhibitor, or an SSRI. However, prior to prescribing, risk of self-harm, comorbidity, accidental overdose, age of patient, cost and side effects, and personal preference must be considered. It takes time to find the right medication as well as the right dosage. For this reason and others, drug treatment for GAD should always coincide with strategies to address the cause of the anxiety. Yoga and breath intervention programs have been shown to show positive adjunctive treatment for those suffering from GAD. A study was done using a particular yoga course called Sudarshan Kriya Yoga, or Sky Yoga. The clients who took on this treatment were those who, after 8 weeks of traditional therapy, did not yet achieve remission of symptoms. The results showed that for those who completed the course found significant relief of symptoms. The Sky Yoga course proved to be effective in task-oriented coping as well as emotion-oriented coping. Yoga helped reduce thoughts of catastrophizing events and improving acceptance of unwanted events. Less adaptable personality traits even improved in terms of psychological distress using this technique. For these reasons and more, yoga is found to be an effective adjunct treatment for GAD sufferers. Another research study found that worry exposure and applied relaxation are effective as standalone treatments. Worry exposure utilizes a plan in which the client is given homework that directly exposes them to their worry. Applied relaxation is a technique involving homework, once again, that helps the client to reduce somatic symptoms of their anxiety. Using these as standalone treatments without a CBT aspect meant that no reference was made to thoughts or beliefs. These are usually techniques used within a cognitive behavioral therapy treatment plan. However, the research from this study proves that using these techniques as well as standalone treatments or within the framework of another treatment plan not necessarily using CBT are effective at lowering state anxiety levels. Viktor Frankl, in his book Man's Search for Meaning, says that there is nothing in the world, I would venture to say, that would so effectively help one to survive even the most worst conditions as the knowledge that there is meaning in one's life. Our research into the spiritual and existential aspects of treatment for generalized anxiety disorder uncovered a wealth of information into the positive outcomes of treating anxiety with a bent toward spirituality or existential therapy. Researchers studying the relationship between spirituality and anxiety use a scale that measures for trait anxiety, that anxiety that is intrinsic, and state anxiety, that type of anxiety that is based primarily on circumstances. In measuring both anxieties with a spiritual well-being test, the results revealed that an inverse relationship was found between spiritual well-being and total anxiety, state and trait combined. This test proved true across gender, age, and marital status. Furthermore, the test proved that religious persons who are intrinsically motivated were less anxious as a whole than those who found religion to be simply extrinsically motivated. We can conclude from this research that in working with adults suffering from generalized anxiety disorder, it would be of some use to allow conversation to occur that could address the existential questions of life. Research was done on adults suffering from generalized anxiety disorder to find out if direct experiences of the sacred would decrease their anxiety as compared to others taking part in supportive therapy. Findings indicated that the group connected to the sacred did experience less anxiety than the other group after treatment. Furthermore, carrying on their own treatment plan following counseling was higher in the group who connected more with the sacred. Mindfulness is a proven CBT technique for treating GAD. Traditional mindfulness questions may include phrases like, on what basis do you say that to yourself? Where is the evidence for your conclusion? And the like. The Christian therapist may ask questions more along the lines of, what do you think God has to say about this? And what does the Bible have to say about this? These more existential questions can help some find meaning and ask the deeper questions that may be causing the anxiety. A Christian perspective offers hope to the worried client. Instead of only focusing on the here and now, a Christian perspective can help the client be able to look ahead to the future with hope instead of dread and worry. Treating children and adolescents for generalized anxiety disorder is of special interest to both Brooke and me because of our own stories of dealing with anxiety in our own children, so we included some information we gleaned from research into this project. It is common for GAD to first appear during adolescence. Furthermore, if there is childhood maltreatment, there is a possibility of earlier onset. Our research indicates that it's estimated that 40% of childhood maltreatment sufferers develop GAD. Neuroscientific results indicate the presence of different brain structuring for those with GAD sufferers who also experienced childhood maltreatment. Knowing this, we have more information in working with adolescents who have history of maltreatment to better diagnose their anxiety with usual depression comorbidity. Our research also indicates that an effective treatment for adolescents with generalized anxiety disorder is an existential or spiritual approach. Spirituality or religious beliefs can cultivate a belief in adolescents that their life has meaning and that they have some control over their fate. The research indicates that greater spiritual well-being predicted lower trait anxiety, especially amongst at-risk youths. These youths struggle with purpose or meaning, and an existential or spiritual approach helps reduce their symptoms. As image bearers of God, we are not made to live in anxiety. The shame and fear associated with sin separates us from the peace of God which transcends all understanding. It is mine and Brooke's prayer that as clinicians, we will be wise enough to know how to care for all individuals facing the anxiety ultimately associated with the fall and to bring them back to a place of hope and peace.